ends. I would like to tell you a little bit about SHARE. SHARE is a national nonprofit that supports, educates, and empowers anyone who has been diagnosed with women's cancers and provides outreach to the general public about signs and symptoms, because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, and our helplines, please visit our website at sharecancersupport.org. Now, we ask that all participants stay muted while other people are speaking. You are welcome to submit questions through the chat feature at the bottom of your screen, or you can come off mute and ask your questions directly to the panelists. The presentation will be recorded and will be available on SHARE's website in 1 to 2 weeks. So please note that if you do speak, will be in the recording. This evening, we have 3 long-term TNBC survivors to talk about how their knowledge of TNBC has changed since diagnosis, what they knew then, what they know now. Also, they will share their tips and tools for how they've coped mentally, emotionally, and ways that they've managed their health post-cancer. So now I'd like to kick it off to our panelists. Each of them will introduce themselves. So I'm going to give the screen over to Nancy.
Awesome. Thanks, MC. And thank you all for joining us tonight. I know many of you because I am the usual facilitator for this group, but tonight I'm taking on a different role as a panelist. And I was diagnosed with stage 2 triple negative breast cancer in February of 2015. I was 33 years old. And I went through adriamycin and Cytoxan chemo, followed by Taxol and carboplatin. And then I had a lumpectomy and I had radiation. And happy to delve more deeply into each of those as we go. But we'll turn it over to Cynthia Washington, one of our other panelists, for her to introduce herself.
Hello, my name is Cynthia Washington. I'm a 2-time breast cancer survivor. I had my first diagnosis in 2008 as DCIS, which is stage 0. And that was after I advocated for myself. And then in 2016, during my regular mammogram, I was diagnosed after a biopsy with triple negative breast cancer. Both times it was in my left breast. So the first time I had a lumpectomy, and the second time I had to have at least a single mastectomy, but I opted for a double mastectomy as breast cancer runs in my family. My mother had breast cancer twice. Her oldest sister had breast cancer in 1972 and died from breast cancer. And her baby sister had breast cancer 3 times. So I just went on and had the double mastectomy because I didn't want to hear those words. You have breast cancer again. So I've been living with TNBC for quite a while, and I think I'm doing very well.
Glad to hear it. Christine?
Hi, everyone. My name is Christine Benjamin, and I was diagnosed with TNBC in 2000, even before it was called TNBC. And I was 36 at the time of diagnosis. I had genetic testing and discovered that I had a mutation in the BRCA1 gene. And as a result of that, and my family history, I had a bilateral mastectomy, followed by chemotherapy, and then an oophorectomy a year later or so to prevent ovarian cancer, which also runs in the family. And full disclosure, Nancy and I are sort of connected. Our families are kind of connected, which is how we met. So when Nancy was diagnosed, we were able to connect and, get her some support as well. So it's nice to be here with everyone, and I hope we can answer your questions.
Okay, so you heard a little bit about your stories, but we'd love to hear a little more, such as share a little bit about what you thought about when you first heard those words, triple negative breast cancer, right? And then kind of what you think about it when you hear triple negative breast cancer now.
When I first, well, I was kind of anticipating that I was going to have breast cancer the second time the diagnosis. It scared me because, one, I thought I was in the clear because the normal time passage of 5 years is when you're supposed to be clear. And this was 8 years later. And I ended up with triple negative breast cancer. And I found out that that breast cancer was the most aggressive. And after surgery, there's no maintenance medicine for stage 1, 2, I don't think 3, but TNBC. So I knew I was going to do bilateral mastectomy, but it was scary. And then, of course, the doctor explained what the triple negative meant, that, you know, it didn't have the receptors for protein, estrogen, or progesterone. So it was very scary, and I was told that I would have a 33% chance of recurrence. But I just celebrated my 5th year, and I have had no occurrence, and I don't anticipate, I'm not going to even hold on to that, you know, I will survive this until maybe I'm 80, 90. Well, my aunt is 94. I was telling you, she's 94. So maybe, you know, well into my upper years. But it was very scary, and it's very aggressive. When I was diagnosed, I was stage 1. And within 30 days, I was stage 2. Before I had the surgery. So it was moving quickly. Blessedly, I was blessed not for it to be in my lymph nodes. I only had 2 lymph nodes removed. So, but with any lymph nodes removed, there's always a chance that you will get lymphedema, even late, you know, even later on. So, but so far I've been blessed with that. And I did have some problems with, you know, with my treatment. I was supposed to get reconstruction. I did not opt to be flat. I'm flat because my reconstruction failed. I was the only one smelling rotten cabbage. I was like, I smell rotten cabbage. Does anybody not smell rotten cabbage? And they were like, no. I'm like, I smell rotten cabbage. Well, come to find out, my breasts were infected, and I guess I could smell the inside of me. Nobody could smell the inside of me, but I could smell that something wasn't right, and you know. And I end up going to my primary care versus my plastic surgeon and my breast surgeon. And you know, she was like, let me call and check and see what's going on. Well, they said it was because I was diabetic that I was having these issues, but I've always been a controlled diabetic. So later on, I found out that cadaver tissue was used in the reconstruction, and I was not aware. That was not discussed with me. I put it that way. It was not discussed with me. But when I went back and looked at the paperwork that I signed on the day of the surgery, that it was in there that they were using cadaver tissue. And if I had, you know, noticed that, I would not have agreed to it. I just wouldn't agree to cadaver tissue being used in me. And I think my body really, that was what caused the infection, that my body rejected that. So I ended up having my inflators removed and, you know, getting attention by the plastic.
Oh, you just went off mute, Cynthia. Ooh. Did she just disappear?
Yeah, her video just went off too, and audio. So Cynthia, your video went off and your audio went off.
Uh-oh.
I'm sorry. Yeah.
Oh. Don't you love technology?
I'm sorry. I got a call coming in, but anyway, I'm sorry. After my inflators were removed, I was getting follow-up, and my drains ended up not working properly. So the doctor was like, you're going to need to have a third surgery. I was like, what? Because I just had the bilateral mastectomy. 2 weeks later, I just had the inflators removed and everything, removed with it. And then 2 weeks later, he said, you're going to need a third surgery because your drains aren't working properly. He said, but I'm going to try I'm going to try to manually express the fluid buildup and see if that will work. And in the office, so we went into the office, and he began to remove the drains and to manually express the excess fluid buildup. And what happened with that, he was able to get the fluid out, but then I was left with a wound, a deep wound, and had to have wound care. And at that point, Blue Cross Blue Shield said, we want to put her under special care. And so they had me followed very closely and paid for everything. I didn't have to pay for anything at that point. I had gotten pretty close to the time span where chemo is supposed to be most effective. And my oncologist was saying to me, if your wound blows up, your wound blows up. You got to get this cancer, we got to kill this cancer. And one of my friends told me about Juvia protein drink. And the day before I had my port surgically implanted, I was healed. So with prayer and belief and I was able to get the port in, my wound was healed, and start chemotherapy right after Christmas in 2016. And of course, I started with the Red Devil, the AC, and I did that for 4 weeks. And right after that, I did Taxol. But that's not the end of the story, because because halfway through my Taxol treatment, I got a rash. And my daughter was like, I didn't know I had a rash. My daughter was like, Mommy, you got a rash. I said, they told me I'm supposed to call if I get a rash. So I called and they said, it was on a Friday evening. So they like, well, just watch it. And then let us know if it gets any worse by Monday. So Monday had gotten worse, and they told me to come in Tuesday. And so I went in Tuesday, and my oncologist did not see me. He had his physician's assistant see me. And she was like, wow, you do have a rash. It went from here, it had gone from here and went all down the side of my face, all down the side here, all down my back. And so she was like, she said, have you had a breakout before? And I'm like, well, I have had some allergic reactions before. They never were able to tell what they were caused by. And so she said, and this is so strange. It's just on one side of your body. And I was like, yeah, I said that. And she said, well, let me go talk to your oncologist. So she comes back out, about 30 minutes later and says, he's going to send you to the dermatologist on Friday. This was Tuesday. So I was like, okay. So I took a picture of it and I posted it on Facebook. And all my friends started telling me, you have shingles, you have shingles. And so I went to patients first and they said, you have shingles. And they said it's textbook because it's all on one side. And so I said, we're going to have to take your blood levels and make sure, because you might have to be hospitalized because you get shingles because your immune system has dropped so low. And of course, I had chickenpox as a child. So, but nobody during all these doctor appointments and whatnot, no one ever said take the shingles vaccine before you start your chemo or anything like that. But then I had to follow up. I had to pause the chemo. And then I had to follow it because it was so close to my eyes. They didn't know if I had damage to my eye nerves. So I had to go to the ophthalmologist and be tested to see. But blessedly, I didn't have any damage to my eyes. So I was very thankful for that. And I completed my treatment and went on to, as my doctor said, now you can go live your life and just get your follow-ups every 3 months, every 6 months. And now I'm on once a year.
Fantastic. A lot of complications in your story, and it hate to hear any patient having to go through so much. So let's hear from Christine. Let's hear a little bit of your story and your treatment.
Sure. So I actually found the lump by myself, but I was expecting that I might get cancer because there was a lot of cancer in my father's side of the family. And before that, maybe 5 years or so before that, I felt a lump in my breast and I went to the doctor and told her about my family history. And she said, you don't have to worry because breast cancer runs on your mother's side of the family, which now we know is not true, right? But I present again with this lump, had a biopsy, and sure enough, it was cancerous. And my cousins, how I'm connected to Nancy, right? My cousin, Terry, died from ovarian cancer 3 months before I was diagnosed with breast cancer. And she was one, out of many women in our family that was diagnosed with either breast or ovarian cancer, premenopausal, who did not survive. So I thought, 36 years old, premenopausal, being diagnosed, I'm not going to survive either. And so that was sort of my mindset going in, or my belief going in. And I, acted as aggressively as possible with treatment. The genetic testing made me decide to have, the bilateral mastectomy and also have my ovaries removed to prevent the possibility of ovarian cancer. So it was so long ago, the protocol for treatment has changed since then, right? So before there was surgery and then chemotherapy. Now there's chemotherapy and then surgery. So had the chemotherapy. I was told that, most cancer patients are not really affected by nausea or weight loss because there's so many good drugs, right, that prevent nausea. And the drugs are they work on 95% of the people. Well, of course, they didn't work on me. And so I was at the 5% of the people that, really had a hard time with nausea and nothing worked, just nothing ever worked. And I think we're being recorded. I don't think this will be held against me in a court of law, but one of my aunts who, who's Terry's mother said, what really helped Terry was to smoke pot. And I'm like, oh, I hated it, didn't like it during, my teenage years, was never into it, but I was pretty desperate. And I tried it, and literally it was the only thing that helped to relieve the nausea. And I was able to, keep some food and liquid down, but, I'd lost a ton of weight and, just kind of had a difficult time. But treatment, kind of went through it, and no radiation after that. Had the usual treatment, ACT, pretty typical for triple negative, at least back then. Now there are new agents that have been developed. And, I didn't really have any complications. I had bilateral mastectomy with reconstruction. Maybe a couple of years later, I had an issue with an implant, had the implants removed and exchanged. And then recently, so now it's been over 20 years, right? Almost 23 years. I'm a happy old lady now. But had another issue with the implant and just had exchange surgery again last year. So, it is kind of the gift that keeps on giving, but, relatively minor in the scheme of things. I think one of the scariest things is that with triple negative disease, that there's no maintenance therapy, right, afterwards. Cynthia kind of mentioned, and all the other women that I met, all my peers, all my friends, my breast cancer friends, most of them were ER positive. And so they had hormone therapy, after treatment to help reduce the risk of recurrence. And I didn't have that. And so, I kind of lived in fear for a good 2 or 3 years, thinking about, it's going to come back. I was told that if triple negative comes back, it comes back within like the first 2 years. So there was a lot of fear around it coming back because I knew what my family history was. And I was just sort of waiting for it to come back. And then finally, one day, I just sort of realized that, I don't know how much time I'm going to have, right? We don't really know how much time we're going to get on this earth. But I realized that I was spending the time that I had really worrying about the time that I might not have. And then something just switched in me. And I'm like, you know what? Something's going to happen. I'm going to deal with it then, but I can't spend my life worrying about it. And, I think as a result of the diagnosis, I've changed my careers. I'm a social worker. I worked with children in the foster care system, and then switched to advocacy and working with breast cancer patients. And I've been doing this now for 20 years. So I am, I like to tell my story, especially to those who are newly diagnosed. I see maybe a couple of women here are newly diagnosed or still in treatment. And the good thing about TNBC, right? You've probably been told it's an aggressive disease, right? But the treatment is very effective. And we have that going for us, right? So when it works very, very well. And there are now new treatments to try, which were not available back then. So there is hope for sure.
Oof. Talk about your story, Cynthia and Christine. My goodness. Nancy, tell us yours.
Mine, there are some parallels with Christine, certainly. We were of similar age. So as I mentioned, I was 33 years old, and I had very dense breast tissue and very lumpy breast. And so I had previously, prior to my diagnosis, had some lumps and bumps checked out throughout the years. I had a surgeon who I would go to whenever I had a concern, and he would always give me an ultrasound right in his office, and he would always tell me to have a good day and call him if I needed to come back. Until February of 2015, I went in and I had a lump that I had found in the shower. It was like 12 o'clock on my left side. And he said, well, let me just give it a quick scan. So we got the ultrasound machine out and turned it away from me, and just was different. He started there was a lot of clicking. He started taking measurements. He started, kind of feeling it. And so I just kind of knew that something was different. He tried to aspirate fluid from the lump. No fluid came out. And so he took a biopsy right then and there, and he looked me straight in the eye and said, I'm going to send this off, but I am almost positive that you have cancer. So 2 days later, he called me to confirm what he suspected, that I did have cancer. And he said, I'm almost positive it's triple negative breast cancer because of your age. And that meant nothing to me at the time. But I immediately became, my own Google certified MD and learned as much about triple negative breast cancer as I possibly could. I talked to everybody who would listen to me, Christine included, and just kind of dove in as much as possible to really understand what was going on with my body and understand what my options were. So my original treatment plan was adriamycin and Cytoxan, followed by Taxol, but I listened to a webinar, and a doctor who specializes in triple negative breast cancer mentioned the chemo drug carboplatin, and she talked about how early studies had shown that carboplatin was very effective in helping people achieve good results from chemo with triple negative breast cancer. So that was all I needed to hear. And I embarked on a campaign with my oncologist to get him to give me carboplatin. And I was the most annoying person on the whole planet. I brought him research articles. I would stop, whenever I had to go for an infusion, I would just make sure that, a note got to him. Every appointment I mentioned it. I mean, I was so annoying. He finally took it to the tumor board, his conference with his colleagues, and they agreed to give me carboplatin. So I felt very victorious that my campaign for carboplatin worked, although it made me feel dreadful. Much like Christine, if there was a side effect from chemo, I was getting it, and I was feeling it very deeply. I did take Christine's advice, and that did help me with being able to eat food and being able to, help to reduce pain. And so I did end up having really good results from chemo. My lumpectomy showed that there was no residual disease from that chemo had killed all of the cancer. So I was incredibly relieved by that. And then the rest of my treatment was fairly straightforward. I had a lumpectomy, 3 lymph nodes removed, and then I had 33 radiation treatments. But I will note that the emotional ramifications lasted way longer for me than the physical ones. The physical side of it, I got, I healed fairly quickly. But the emotional side of it, I really struggled with that. I saw therapists during my treatment and after my treatment, and I really attribute that to, being able to get through this from an emotional perspective. I remember sitting in her office one day and I just said, when will it get better? And she said, usually at the 2-year mark, you can start to see, the kind of emotional side effects start to taper down. And I think she was probably right about that. I mean, I do think, 2 years, 3 years, every year it gets better. But there's not a day that goes by that I don't think about it. Even now. So, the therapy for me was just as important as the rest of the treatment, because it did enable me to, to be present for my family, to be present, for my friends and my career, and to be present for myself. So that was a huge, huge component of my treatment.
With all 3 of you been through so much, and of course, it's always your patient right to get pushy. Always remember that it is your patient right to get pushy on something that you feel very strongly about. So trust your instincts. I'm curious, and this is one of the questions we received ahead of time. What do you wish that you knew, and what do you know now that has helped you in your survivorship? Because it sounds like, it's a scary time within that, first 2 to 3 years in that survivorship. Do you really feel like you're in that survivorship stage and thinking of TNBC and not having, maintenance treatment? Let's talk a little bit about how your survivorship and your thought process has changed from initially to where you are now. Cynthia, why don't you lead us off on that?
Well, I know the one thing you were mentioning was, what did we wish that we know back then? And one of the things that I didn't know about was ice therapy. Ice therapy for to reduce or prevent neuropathy. I still suffer from neuropathy in my feet and in my fingertips, and I was never told that ice therapy during chemo could help reduce or prevent that. So I'm 6 years out, and I know when I got neuropathy and I discussed it with my oncologist, he was like, oh, in 10 years, it'll be gone. And I was like, well, in 10 years, well, I'm like, that's a long time, 10 years, will I even be here? But I wish I had known that. And it's something that I feel is not shared across the board. depending on where you go, one of you start to meet other people and discuss their treatments, and a relative of a relative mentioned that they had taken TNBC, and that they had taken the ICE treatment, and they didn't have neuropathy, and they had gone to the National Institute of Health, which is a big name hospital, versus where I went. It's a big name hospital. I did get three three diagnoses to confirm. I went to Georgetown originally, Georgetown Hospital in Washington, D.C. Then I went to Sibley. They have a program with Johns Hopkins. And then I also went to the Cancer Center of America to review my biopsies, to review my treatment. And they all basically came up with the same plan, except for the Sibley Johns Hopkins was a little more aggressive. And they wanted to give me the chemo every 2 weeks. I think it was every 2 weeks. Because it's been a while now. That's one good thing. You forget about certain, I think every 2 weeks instead of every 3 weeks. And someone was mentioning, well, my doctor wants me to do every 3 weeks to prevent any heart issues, because when you go through chemo, you can also end up with damage to your heart. So I'm like, look, my heart is important too. So I'm going to, since 2 of the 3 recommended the same exact treatment, I went with the less aggressive treatment. So that's one of the things that I wish I had known, is about the ICE treatment for, neuropathy, because that's like one of the major side effects that I'm living with. I was blessed to have a mentor who kind of, was able to guide me through the process. Just someone that my daughter knew that had been through triple negative breast cancer and chemo, and they gave me heads up to the mouth sores, because I did get mouth sores, and I had to get medicine for that. They gave me heads up to being able to get wigs, how to get wigs, and special bras for breast cancer patients. So I was able to get some heads up with that. Also, at one point when I had my first breast cancer, I had just lost 50 pounds to bring me down from 300 and some pounds to 250. And I wish I had known that there's a big, big, big connection between being overweight and getting breast cancer. I did have the genetics test, so I did not have to have the hysterectomy. They thought I was going to have a hysterectomy if they saw any connection between my breast cancer and that. So, but I did have the genetics test, so I was, I knew about that, and I had it with my first instance as well as my second occurrence of breast cancer. So, like I said, the main thing that I was kind of, that I'm suffering with now is the side effects of neuropathy. And then the other thing is that that I'm dealing with now is self-image. Being a woman without breasts, even though I'm 65 years old, I still want to be the best me I can be. So, I look in the mirror and I see the scars, and and because I, was heavy, I have a big stomach, and now that I don't have the breast, people ask me constantly, when is my baby due? They'll say, oh, when is the baby coming? And, and even when I was at a senior event, and I was even asked that, and one of my friends was like, we're at a senior event, why would you ask her if she's pregnant when you're supposed to be 60 and above to be here? She said, oh, I thought she was in her 40s. It doesn't matter. It's just, it's just not something that you should do. But I was not able to get the deep flap because they said I was diabetic, and like I said, I had the problem with the implants. However, what I did do to try to go through another type of surgery, a panectomy, is and to lose weight, to come off my diabetic medicine and all that, I had a sleeve bypass. So I had that, and I lost some additional weight and came off the diabetic medicine. So that's how I'm living with it. That's the thing that I, wish I had known ahead of time, the two things, the weight management and the ice treatment. Also now I hear, I don't even know if it's related. I mean, one of the things that's going on is that perms and colors can increase your chance of breast cancer. And that's something I didn't know. Now it's like, I have to admit, I have colored my hair and permed it, even though I know, because I'm like, okay, I've been doing it all. I already had breast cancer twice. I'm like, I'm gonna live my best life until I can't live it anymore. So, but that is something that maybe if I had known prior to getting perms, prior to even starting the process of getting perms and colors, like, we should accept our natural hair and not increase our risk of getting breast cancer. But I'm like, I've had it twice, so I'm just going to live my life. I'm 65, and I'm just going to live my life the best I can.
Absolutely. And also there are some natural hair dyes, but I think it's very important that we all think about the toxins and chemicals, because bodies change once you've gone through cancer. You may not be able to fight off certain toxins like you would have been able to before. So let's go to Nancy. Tell us a little bit about what you wish you knew in the beginning of your survivorship and what's kind of changed or helped you now. And I know you did talk a little bit about that mental health portion and getting therapy.
Yeah, and I'll talk a little bit more about that. So, related to my treatment, that I just wanted to make sure that I didn't have any regrets. So I tried to be as aggressive as possible with my treatment, and was and remain confident about my treatment options. I think the one thing that I wish I knew a little bit earlier is just how to request that people communicate with me. People say the wrong thing all the time. We've talked about that quite a bit. People say the wrong thing. They say things that are offensive, and it's because they don't know what to say. I truly don't think that. I think most people do not have, bad intentions. But if I could go back in time, I would have a better toolkit of telling people how I need to be communicated with during this time, because people do, they say hurtful things, they say things that make a little bit of a negative impact, and I would dwell on those, and so I think I have a better sense of appropriate things to say, and a better sense of being able to tell people communicate my needs to people.
That's so important. Sometimes you have to teach people how to talk to you,
Yeah.
Christine?
So, I think that the number one thing that I tell people now, so newly diagnosed people now, and this is something that I wish I knew, is that you really have to learn how to deal with the anxiety, right? Because with a cancer diagnosis comes anxiety that is now going to be with you, going to be on your doorstep for the rest of your life, right? And you're going to worry about it in one way or another, and that'll change and vary over time, right? But it's really a great idea to learn how to develop different coping mechanisms to deal with that anxiety, because as we know, it could take on a bunch of different forms. It could take over people's lives. And so that's something that I wish that I knew. Like Nancy, I also went to see a therapist because I realized that I wasn't able to really share my true fears, right? The people that loved me were scared about what was going to happen to me. Many people didn't understand. I think some of my friends and family members, sort of minimized it, as people sometimes tend to minimize breast cancer, early stage breast cancer. Oh, it's very treatable, you'll survive, you'll be fine. And because there's a genetic component in my family, right? My father, who I inherited that mutation from, felt terribly guilty. And I didn't really have anyone to really talk about my deepest fears. And so therapy was really, really helpful. When I was diagnosed, it was like, the internet wasn't like it is now. There was not a lot of information. Like, people were just getting online, right? And so finding information was really difficult as well. And I wish I sort of knew about, like maybe a patient navigator or a nurse navigator, because I had to figure everything out by myself, right? And it was a lot of work. It was a full-time job. So, I think the world has changed since then. I think it's, in many ways, there are many more resources available. There are, groups like Nancy facilitates specifically for triple negative disease. There's so many resources, tons of support, and that just didn't exist back then. So, it was a very lonely experience. But then I found my people and it got better.
I mean, you bring up such a good point. All of you, and I'm sure all of you in here too, know that it is about finding your community, right? To be able to talk about and release all of that anxiety and fears, and knowing that someone else will understand, and not having to deal with that toxic positivity, and that it's okay to not be okay, and to get professional help, because, cancer is not the flu. And TNBC is difficult. It's a difficult cancer, and that it's okay to realize, hey, I might need a little bit more help to develop some maybe different coping skills, because this is new, right? Want to get to a couple more questions that we had submitted here. You're talking about, all of you right now, all three of you have mentioned like some of the support, your support systems. What was your network that you leaned on when you were initially diagnosed? Like, Christine, I know you mentioned that was very lonely for you. Was there any type of support system without all the technology that we have now?
So, I want to preface that with, I have an amazing family. I have a very, very large family, and people tried to do everything for me. But I was still lonely because I couldn't really, just feel how I wanted to feel, right? Because I saw how it affected everyone. And so that's what made it lonely. So I had people around me, but I couldn't, be my authentic self at that time, right? I was too concerned about everyone else's feelings. I discovered an organization that catered to young women in breast cancer, and, found a good group of people there. I think there was still, TNBC was not labeled TNBC then. And so like the only one that I knew of that, was not diagnosed with an ER positive breast cancer. And so because the treatment's different, there was still that sort of isolative piece to it. But I did have, there were people around, like, absolutely. But as everyone, sort of alluded to this, right? People don't know how to act around people that have cancer sometimes, and want to be helpful, and end up, conversely, sort of not being helpful sometimes.
Cynthia, tell us a little bit about your network that you leaned on, with that initial diagnosis, and then, your second diagnosis of TNBC, and how that's changed.
Initially, I mean, in both instances, my primary network was my family. Um, when I had DCIS and I went through the radiation treatment and I dealt with the burns and the soreness and all that, and the lumpectomy, and as my ex-husband called it, my dented breast. um, I dealt with all that, and I said, oh, it must have been a fluke. But when it's something about when you hear triple negative breast cancer, it's like the ish got real, right? So lots more. I mean, it was a close network of my family with DCIS, but when I got TNBC, the network expanded, and it was mainly my family, but it became my family friends, my sister girls. It just grew widely. And as I wanted to learn more and participated in more things, like Living Beyond Breast Cancer, I met several people at that conference and made several close, we call us breasty relationships. And my circle keeps growing. I mean, it keeps growing, and people still need one another. I just met somebody last week who was diagnosed with TNBC in 2012, and we connected. She's like, you had TNBC, it's like it's a sisterhood that you really don't want to belong in, but the support, the care, the enveloping of love is just something that you appreciate, and you're just there for everyone. And of course, we don't know how it will turn out for others, how it will end up, and we're there for them. I have met many friends. Some are now stage 4, and they've been battling stage 4 for a while. And of course, we try to be there for each other. So not only do I have my network of family and my sister girls, now I have my breasties. And I also joined through my mentor girlfriend, Breastie. I joined a support group that's actually for all types of breast cancer, not just TNBC, but that gave you support in terms of knowing that you can survive it, you're not alone, and that you're okay to feel what you feel. During my TNBC, I decided that my love cup was not being filled, that I didn't feel like I was receiving what I needed. And it was kind of funny because I was going through these conferences, and every time I would go, it seemed like they were doing your love analysis, what you were getting, and I felt like I wasn't getting the love that I needed and the attention. And as a result of my love cup not being filled, along with other things that were happening, I decided after 40 years to get divorced. So I said I didn't know how much time I had. I didn't know if it would come back. And I just wanted to live my life the way I wanted to live it. My ex and I are still friends. We have a daughter, we have a granddaughter, so we always will be connected. But I needed more in my life. I needed to do more. I'm more of an advocate now. I do lots of advocacy things, sit on a lot of panels, discuss the connection between heart disease and diabetes, and doing our hair, and what self-care items we need, and putting ourselves first, and just taking the time out to love me more, and to receive love and love and attention that I felt like that I wasn't getting.
Ooh, I love that. Fill your love cup, love yourself. Ooh, that is powerful, powerful. And Nancy, what you're telling us about your survivorship. Wait, did you already tell us? Sorry, now I've lost my train of thought because I was just about filling the love cup.
Yeah, no, I haven't talked about support system, but happy to move on if you want, if there's another question that you want to ask.
I do have another question. And also too, I'd love it if some of y'all in the chat can fill out like the year you were diagnosed, when you were diagnosed. I'd love to know, Christine. Love to know, our panelists would love to know. Kind of share your story here as well, because we are a community. So how about this, Nancy? You know, where were you treated originally? Was it in like a big hospital and community setting? Like, what was that like? And do you still have follow-ups now?
Yeah, so I lived in South Carolina, in Charleston, South Carolina, when I was diagnosed, and I was treated in a fairly large center as far as Charleston, South Carolina goes. And I do have follow-up. So after we moved from Charleston to Atlanta in 2016, so fairly shortly after my diagnosis and or my treatment ended, and I've seen an oncologist here since. I started seeing her twice a year, and I would do a mammogram in January and then an MRI in July. And then I graduated to seeing her once a year. And so now I do a mammogram and an MRI in January, and I see her shortly thereafter. She did mention that I might graduate to not having to see her at some point, and I politely declined that opportunity. I'm not there yet. And I don't know, maybe I will be, maybe I won't. But I like still having the surveillance, and always do a mammogram. I'd like to keep up the MRI just because I do still have breast tissue, and it is still very dense breast tissue. So for now, I will continue to see my oncologist yearly.
Interesting. Christine, what is your follow-up like? I mean, you being diagnosed almost 20 years ago, how has that changed?
So I saw my oncologist for a number of years, probably up until 5 years ago. And that changed because she died. She died of cancer. And now I see a breast surgeon. I see my breast surgeon. I've seen my breast surgeon every year for almost 23 years now. And talking about advocating for yourself, right? So the implants have been in for over 20 years, and they sometimes have a shelf life of like 10 years, right? That's what they tell you. And I'm like, don't you think I should have an MRI to sort of check it out and see what's going on there? And she's like, no, they're fine. I'm like, are you sure? It's been a long time. And she said, all right, I'll send you for it. Sure enough, one of them was ruptured. And, I had that surgery to fix that. But so now I do not see an oncologist, and it doesn't concern me any longer.
So Cynthia, are you
Yes.
like, what is your follow-up like now, especially it's having that cabbage smell? Do you how does that make you feel, and what is your follow-up with your doctors?
Well, initially I was followed up every 3 months with blood tests to check my cancer levels and cancer markers, and an X-ray, a chest X-ray. And so I do that same process, but it's gone from 3 months to 6 months, well, 3 months to 4 months to 6 months, to now I'm up to a year. So I just had my most recent visit in September. So it will be another year before I go back to get it checked. Of course, I hold my breath. I don't know. I mean, I've done the 5 years, but I mean, I did the 5 years before. So that's the only follow-up I do. I don't have breasts, so I don't, I can't do the self breast exam. I can't do the mammogram, so all I can do is the chest X-ray. or MRI, or, if they had, or maybe a PET scan, if they felt like it was something that I needed to be further checked into. But right now, it's just the blood test to check my cancer markers and a chest X-ray, and then of course the discussion with the oncologist.
Right. I do have, this is an interesting question, and then we'll start to wrap up, but I just want to first acknowledge all of you who are here tonight and also in the chat. I hope that hearing from these long-term survivors is giving you hope, because it seems many of you have been diagnosed, 2019, 2020, 2021, 2022. So hoping you're really getting some great insights here. This is a scientific question here for our panelists. Have any of you heard of other TNBC patients who developed ER-positive microinvasive ductal carcinoma in the same location? Have you heard of that? Any insights to that?
No.
Nope.
I have not. No.
Okay. Well, so whoever asked that question, don't you worry, we will do some research and get back to you. So because the video will be available in 1 to 2 weeks, so we'll hopefully have some information on that to attach to it, okay? As we wrap up tonight, I would love each of you, our panelists, to give us 2 things that you would like everyone here tonight to take away. We'll start with you, Nancy.
Okay. My 2 biggest takeaways are, number 1, to advocate for yourself with your medical team. I feel like that's incredibly important. And a cancer diagnosis, especially a triple negative diagnosis, can be so overwhelming that I think sometimes you get caught up in just being swept into, all of the next steps. It's okay to pause and think through what you need and really advocate for yourself. So that's number 1. And then number 2, which I think is equally as important, is to take care of your mental and emotional health, because a cancer diagnosis is it's one of those lines in the sand in your life, and things are never the same after you hear those words. And so I think just doing whatever you can to emotionally care for yourself while you're caring for yourself physically is incredibly important.
Cynthia, what are the top 2 things you would like everyone to take away tonight?
1, I agree with the advocating for yourself, because that's how I found out about my first cancer. Is I advocated for myself because of my family history. And the second thing is take care of your body, not, the mental, the emotional, the physical, making sure you eat right, making sure you exercise, making sure you do the things that make you happy, bring joy to your life. Also, I got a third one. Mm-hmm. Also, don't be afraid to get a second or third opinion. Don't just take it for granted that one doctor's perspective is the only perspective. Get a second opinion, get a third opinion. If someone doesn't, if you think you feel a lump, or you think it's, it doesn't matter how young you are, old you are, and they try to push you away, go to someone else and advocate for yourself and get another opinion.
Thank you. Christine?
I think my number 1 takeaway is that you're not alone. You don't have to be alone. You don't have to go through this alone. There's so much support available. And, I oversee all the support and education services for SHARE and MC. Megan Claire heads up the breast cancer education support services for SHARE. We have people that will follow you and call you and be there for you. We have amazing support groups. Like, you don't have to be alone through this. So many people who want to help you. And I think Nancy and Cynthia already said my other two, it's so important to take care of your body. And, my big thing is movement, right? Just move whatever that means for you, just move it and keep it moving.
Well, thank you. Hello. Sorry, my cat decided to wake up for a quick second. Thank you everyone so much for being here. Want to give a big, thank you and round of applause for our panelists, Cynthia, Nancy, and Christine. And thank all of you for participating tonight and submitting your questions. And we'll get back to that one question that we couldn't answer. So don't worry. And want to make sure that all of you remember, fill your love cup, and that love should be for you, right? Thank you, everyone. We'll see you again soon.
Thank you
Bye-bye.
so much.
Bye-bye.
Bye-bye.
Bye.